It is. Good afternoon, everyone. I'm Becky Widish, Chairman of the Niagara County Legislature. Thank you for joining us again live on LCTV for our Niagara County COVID-19 updates. We're also currently streaming live on lctv.net and on 90.9 FM on your radio. I'm joined again today by our Director of Public Health for Niagara County, Dan Stapleton. Dan, welcome.
Thanks, Becky.
Thank you for being here with us, and why don't you just go right ahead and start us off with our newest COVID-19 statistics.
Sure. Well, our numbers continue to improve almost every week. We have 13 new positive cases since Friday morning. So when you look at a daily rate, we're right where we want to be. That's so far we had 1,420 positives to date. So we currently have 53 active cases. 4 of those people in the hospital. We have 1,271 people who have recovered. So the numbers are going in the direction we want to. I'm always hesitant to say things are great because I don't want to set people up with false expectations. But right now, our numbers are all trending the way we want them to.
Absolutely, and I think the best news to let everyone know is we've now gone a full week with no new COVID-19 related deaths in Niagara County. You know, for some time there we were announcing those deaths day after day, and it certainly was the hardest thing throughout this pandemic that I've had to do is to announce the deaths of those residents. But again, we've gone one full week now without any. We continue to stay at a total of 96 throughout the time of the pandemic, so very good. Now, our Niagara County heat map is updated again for you today with the newest numbers of our cases. Again, this map breaks down all of the positive cases throughout the pandemic by municipality, so you can see that what towns and cities those were happening in. And you could find this heat map on the niagaracounty.com webpage. At the top of the page in the COVID-19 banner, there's a link that will take you right to that map. Now, so far we've seen over 390,000 views of that map. So we know it's important to you. We will continue to update those numbers as we get them in and have new information. I want to switch to testing because this is another very important one. The state testing tracker now tells us that we've had 49,674 Niagara County residents tested for COVID-19, which is wonderful. You again can find that link at the top of our Niagara County webpage. There's a link that will take you right to that state tracker, and that one will break down all of the information for our county so that you can compare it to other communities across New York State and see where we stand as a county. There are many testing sites throughout Niagara County that are up and running for you if you need them. Again, you can find a link on niagaracounty.com. If you just click on that link, it will take you to the state page. You'll be asked to enter your address, and it will give you all of the information about all of the testing sites that are available in your area. And we want to remind you, of course, that you do need to pre-register for those testing sites, so make sure that you call the number that you find with that testing site to find out what their requirements are and to make an appointment. Don't just show up there. You do want to register ahead. Very important. Now, clearly testing is one of the numbers we look at. Very necessary to know that data so we understand where we stand as a community. Our daily infection rate is something that we watch very closely, Dan. And can you tell us, what are you seeing now with our infection rates in Niagara County?
Well, as of today, we're 2.9% since the crisis began. Continues to be less than half of what the state average is, excluding New York City. So those numbers are where we want them to be. continue to decrease. The other number we look at is the infection rate on a daily basis, and we like to be right around 1%. We believe that until we have a vaccine, we'll continue to hover right between 1 and 2%. But right now, today's rate is 0.4%. We've been consistently under 1% for a number of days now, and those numbers continue to improve. Another important number that we look at is the infection rate needs to be at 5% or less in order for schools to get the approval from the governor to open up. And at the rate we're at now of 0.4%, we're well under that threshold when we expect we'll be able to move forward with discussions about moving the schools to open. You know, we talk about the fact until we have a vaccination, we'll continue to have cases. The numbers we look at are making sure that our hospitals aren't overwhelmed, making sure that our number is less than 0.1% on a daily basis. So all the thresholds we look at, we're well below those, and the numbers continue to trend in the way we want, and we're the envy of a lot of other states and other counties, even in New York State.
Absolutely, and that hospitalization rate is the other big number that we look at. That one is very important, as you said, to be sure that we are able to maintain the cases that are happening, and you can see that those numbers stay down where we want them to be. Any other thoughts on those hospitalization rates? Are they staying consistent over the last several weeks?
Well, the 4 people we've today, the hospitalizations across the state are 637. You look back at just a few short months ago, we had 18,000 more hospitalizations than we do now. Mm-hmm. There's no other number in this whole report that's more influential than the fact that we're down by that much. We continue to make sure that hospitalizations stay where they need to be. We make sure that we look at trends, making sure our hospitalizations stay low. We were at 4 today. A few days last week we were 1 or 2 or even 0 on one day. So those numbers are important. We look at long-term trends. Right now the trends are going the direction we want to, and hospitalizations, like you said, are really a very important metric. And right now those are the numbers we're looking at. And like I said, there's other states wish they were anywhere near close to what our rates are. So we're happy with that so far.
Right, and you know, one of the big debates right now is about so many states we're seeing are opening back up with very few restrictions in place, mm-hmm. and some people feel that they're paying a price for that. Now, Governor Cuomo seems determined, of course, to not let that happen here, and really has been demanding an increase in the enforcement of the guidelines here, you know, by local government. That enforcement can involve state agencies like the State Department of Health and the State Liquor Authority, or our local government, like your department and our local police departments and the sheriff. What can you tell us about enforcement of the guidelines and what's happening here locally?
Well, enforcement is a big issue. We're getting calls around the clock 7 days a week about complaints about businesses not following the rules, people not wearing masks. For example, a local restaurant that we're dealing with right now, we're working with them. We're working to make sure that businesses understand what the rules are, but then we also need to make sure that they comply with those rules. So if their staff, for example, aren't wearing masks, that's a big issue. We will work with them to educate them, but we'll only do that once or twice. After that, we call them in for hearing, and we'll have a penalty if they can't comply. We don't want people putting their business at risk by not following the rules. And I think most people follow the rules, but we believe a big part of what we do is educating people, helping them protect their customers. That's really what it's all about. And for the most part, people know the rules and they follow them. But there are some businesses we continue to work with, and that's taking a lot of our time.
Absolutely, and of course making sure the business is aware of what they need to do as far as their staff and their workers. But I think it's important to remind residents, again, you know, those mask guidelines for being out in public and having your mask on are still in place by the state, and very important if you want to be able to go to the businesses that you like. You know, it's not just about keeping yourself healthy, keeping others around you healthy, but really helping those businesses to follow those guidelines. If there's a restaurant that you love to go to, you want them to be able to stay open. And they're trying to keep you safe just like you're trying to keep everyone else safe. So again, I remind you, please, if you are out and about and you want to be at those businesses that you enjoy, do your part and have your mask on and follow the rules in the business that they've been put in place for your safety, and you want to help them stay open as well. We've mentioned what's going on across the country with numbers spiking and rising. Luckily, we're not having that happen here, but of course, we see that travel quarantine that's in place. How is that going?
Well, we're getting a lot of calls, a lot of concerns that people have about people they know, people they see that they know went out of the area and came back and are quarantining. Right now, we have over 30 states that are on that list. So the ability for people to, take the risk when they know the state they're visiting is on the list. You take a risk of having to be out of work for 14 days, needing to stay home. We know that some people have gone away and the state is added to the list on the day that when they're there. And that's unfortunate, but people need to really take this serious and make sure they understand what the ramifications are, the risks involved. The number one thing is we don't want anybody going to a state that has a high level of infection and bringing that back to Niagara County. That hurts our businesses, it hurts our residents, and that's something we want to make sure people understand. There are consequences to the decisions you make, and some of them are very serious. So really think twice before you do traveling outside of our area. Niagara County is beautiful this time of year. Stay local. Try to encourage people to support the businesses that are here, and stay put, because you're putting yourself at risk if you decide to go and then that state is listed on the quarantine.
Right, and you make a good point, Dan, because I've had this question asked of me. I think people were confused about the fact that if they left to go on their vacation and that state was not included yet, if you're gone on your vacation and that state gets added, you are going to have to quarantine when you come back. So very important to maybe look ahead if you're making that decision about whether or not to travel, see where that state is falling in the numbers, and if it looks like there's a chance that could happen while you're gone, because it will apply to you even if you left before that state was on the list.
Absolutely.
Okay. Well, Dan, we've touched on the school issue a little bit too, and as you've said, the way the numbers look right now, we stand a very good chance of heading towards some form of opening in the fall. Now, everyone seems to have an opinion about what that reopening might look like, what the rules and regulations will be in the schools, and I know that the districts are all working on the reopening plans and that you've been working with them quite a bit. Can you share with us some of the discussions maybe that you've had with the superintendents or how that plan is looking?
Sure, yeah, I've met with all the superintendents. I talk with them on a weekly basis. I have a meeting with one of the large school district superintendents tomorrow with his team. So we're providing guidance to those superintendents. We know that most of the schools are going to try and open, but their number one priority and our priority is to make sure it's done safely. So will that mean a hybrid where half of the week is spent online, the other half is in person? Will it mean that some children just won't be able to go to school like they normally do? That's probably a good possibility. We do know it's not going to be like it ever used to be. Whether it's each school is a little different. Some have space to do this, some don't. Some have a really vigilant program to do things online, and some don't. So they all have to get up to that same standard, be able to provide a consistent quality education, and at the same time, number one, make sure not only for the students, but also for the staff there, for the bus drivers, for the school bus aides, for all those people who, the vendors, people who transport children and who teach children and make sure children are safe. All of them are working together. We do know that the Academy of Pediatrics has said that for children, it's more important for them to be in school than to be out. The risk is higher for them to completely stay at home for all their schooling rather than to be at school at least some part of the week. So it's really a hybrid. It's really trying to maneuver all those moving pieces. But I know right now the school districts are under the gun to make sure this happens quickly. Next week, the governor's office will be reviewing all those plans and deciding if their plan meets the criteria that they need. So we'll continue to work with them on a regular basis, offer guidance, and make sure that everyone's efforts and making sure kids can go to school safely, that all those efforts come together to make sure that not only is it a high quality education, but it's also safe.
Absolutely. I know there's many anxious parents and school employees out there awaiting these plans, wondering what their fall will look like. So hopefully we'll hear more about that in the coming week or two. Thank you so much, Dan, for being with us as always and for the work that you continue to do for our community.
Thank you.
But just a few last topics to touch on. I was very happy to see that the trusted traveler programs such as Nexus and Global Entry are now again available to New York residents. As you may recall, the federal government had taken away our state's participation in those programs over a dispute on the state's green light law. When the borders do finally reopen, this is going to be a very important piece to our cross-border commerce, and we need to do everything we can, of course, to get our economy moving again once that happens. So glad to hear that we'll be able to apply for those again, get those renewed, and use them like we were in the past. Related to that, I know it's not surprising to hear that Niagara County revenues have taken a major hit during the pandemic. Much like any other business or household, the county has suffered as well financially. But this week we learned that our sales tax revenue for the month of June was actually up slightly over last year's number, which is good. We are not sure if this is a temporary blip or the start of a trend. Of course, we're optimistic, but we know that, of course, online sales have changed significantly. We've had businesses that have been closed that are now reopening. So, of course, we anxiously await that sales tax news to see where we're heading from here. Despite the good news in June, overall sales tax revenue for the county is down 3% year to date. So down slightly. We're hoping that that increases again next month, but it's a wait and see approach. Now, tonight the Niagara County Legislature will be holding all of our committee meetings virtually like we have been doing, and hopefully this will be the last time that we'll have to do that. We are looking forward, of course, to getting back to meetings in person and inviting the public and the press in again the way we used to. This has definitely been a change for us. We will be taping those meetings tonight, and they will be available for you on demand tomorrow to watch at your convenience so that you can see what we're working on in the county. Now, it's our expectation that our August 4th meeting, the next full meeting of the legislature, will be held in chambers in person. We are, of course, still working on safety protocols to make sure that we can do that safely for our legislators and our department heads. So we will get that information out to you as soon as possible. But it is, again, our intention on August 4th to be back together in person in chambers. I want to remind you, as I have for the last several months, of the Niagara County Crisis Services line. This is 716-285-3515. 24/7 free and confidential help for anyone who might be struggling right now. We know that the last few months have been just so much uncertainty, so much anxiety and concern and worry for so many different reasons for so many people. If you are struggling, if you need help, they are there for you. They want to help you. Again, it's 716-285-3515. If you joined us late today or missed us, you can catch us again on demand. LCTV has been a wonderful partner during this process in helping us get our information out to the public. And they will have a link on their on-demand page of lctv.net so that you can watch this broadcast again in its entirety. We'll also have that link on our Niagara County Facebook page as well for you. And LCTV does put us in their schedule throughout the evening and replay as they're able to. So again, thank you so much to LCTV for your help during this terrible time. We'll be in touch. We'll give you updates as we have them. Continue to watch our Niagara County Facebook page. Watch our media releases that we put out through the press. That's how we'll update you, of course, with our daily numbers as we have been all along, and get any changes out to you that we hear as far as state guidelines or protocols that are happening. For now, most importantly, stay healthy, Niagara.